This video is for all the European medical graduates interested in coming to Finland and thinking about continuing their careers. We will provide information to help you understand the process of gaining the right to practice in Finland. During this time, we'll try to cover the 5 main questions that are asked frequently. Before we begin, the prerequisites for EU medical graduates are different from those of medical graduates from non-EU EEA countries. If you are a doctor from a non-EU country, you can watch our other video, which has all the necessary information for you. Link in the description. Here are the answers to your questions. Number 1. Is it possible for a medical doctor who graduated in another EU EEA country to work as a physician in Finland? Yes, it is possible. In Finland, international medical students are more than welcome. Because the population is getting older, and according to the statistics, there is a shortage of professionals like dentists, doctors, nurses, midwives, and more. As long as you are credentialed and have a license, you will always have a job. International medical graduates who attended a quality program should feel confident about their abilities to join the Finland physician workforce. Number 2. Is it worth pursuing a career as a physician in Finland? Yes, it is worth it. Medicine isn't a career you pursue on a whim. Given that attending medical school and completing residency takes so much hard work, you get to work in one of the most challenging and intellectually satisfying fields. In Finland, you will have a better work-life balance and more reasonable working hours. Number 3. How do I get my qualifications recognised? You need to apply for the right to practice in Finland. What this means is that Valvira, the National Supervisory Authority for Welfare and Health, will check your professional qualifications to decide if your training is at an equivalent level. Another essential part of securing the right to practice is submitting proof of your Finnish language ability. Number 4. How long does the process take, and what kind of documents should I prepare? The answer is not straightforward. It depends on your occupation, but mostly the processing time for applications is 3 to 4 months. But in some cases it will take longer. When you apply, do not forget to include copies of your passport or identity card, degree certificate, a certificate that states you have the right to practice your profession. This recognition should not be more than 3 months old. Certificate issued by the authority about the recognition of professional qualifications. And finally, a translation of your documents either in Finnish, Swedish or English by an authorized translator. Number 5. What is the most crucial factor for getting a job in Finland as a medical practitioner? To be eligible for work as a medical practitioner, you need to have a satisfactory level of language proficiency in either Swedish or Finnish. We recommend Finnish as Swedish speakers account for only about 5% of the population of Finland. Having sufficient oral and written proficiency in the Finnish language allows you the level of interaction and empathy necessary to properly carry out your duties. It is important that no misunderstandings occur between doctors and their patients. What if you don't yet have a language certificate? In this case, Valvira will recognise your professional qualifications for now, and you can provide your proof of language proficiency later to obtain your licensing. If you need help with your language training, MediConnection offers the best medical Finnish courses for healthcare practitioners. You can find more information on our website and blog. Links are in the description, and feel free to contact us with any questions you have. It's worth repeating not to send originals because they will not mail the documents back. Instead, send officially certified copies to avoid delays. Thank you for listening. We hope to hear from you soon.